So resilience refers to an individual's ability to overcome hardship and stress that they may experience in their life. Resilience typically results when our protective factors enable us to bounce back from hardship, and they outweigh whatever the stress is that we experience from that hardship. And resilience is especially important in the early childhood years because we know so much learning and growing and development is critical to children's long-term futures, happens when they're young. And so this is when it's most important to have these protective factors that boost a child's resilience. At the same time, while it is true that what happens early in life sort of sets the stage for everything that comes after, resilience is actually something that we can build across our entire lifetime. So it's not something that says, well, just because we can't prevent kids from experiencing hardship or going through sometimes very, very difficult and overwhelming adversity when they're young, means that they cannot then become resilient, say, teenagers or adults down the line. This is something we can continue to grow and to nurture all throughout our lifetimes. When a child or teen is experiencing significant stress, the research tells us that the most important protective factor is having at least one relationship with a supportive, stable, and consistent caregiver. So that's the place to start, right? Is first, and sometimes that's not a caregiver in the traditional sense, right? Sometimes it's a parent or a grandparent or another family member, but can also be other important people in a child's life, whether that is a teacher, whether that is a coach, whether that's someone at a local community or cultural organization. But the idea being, how do we build really strong and stable relationships? Because this helps kids have a sense of predictability. Even when the world feels upside down, even when I'm going through something, sometimes kids go through things that we can't possibly even imagine. I know that there is one person, a caring adult, who is there for me, who's going to help guide me and will consistently be there to show up and help me figure out what I should do next. Additional things we can do to help kids build resilience are to maintain healthy routines. So making sure, are they getting enough good sleep? Are they following a healthy diet? Are they getting regular exercise? In addition to this caring, supportive relationship that they're hopefully having with at least one adult, how are they doing with peers? Do they feel affirmed? Do they feel seen? Are they able to engage in activities with other people where they feel successful? And do they have areas in their lives where they can nurture their own talents and interests, right? It's so important for kids, especially teens and kids as they're getting older, to feel that they have areas of their own expertise. What am I doing that I just love? Where are areas where I can feel like I'm competent and strong and I can build that confidence and self-esteem? And then lastly, making sure that kids have a nice toolkit of active coping skills. When life feels hard, it's so much easier, and this is just a very human instinct, to kind of shut ourselves away, to do less, to isolate. But actually, we find that those only increase risk for things like depression and anxiety, sometimes over the short term, but definitely over the long term. So how, when I'm faced with adversity, can I reach into my toolkit and use some active coping skills so I don't get stuck feeling that way? So all of these strategies can go a long way towards kids building resilience.